Okay guys, I want to talk to you today about something that we call patellofemoral pain syndrome. Okay, first thing that we need to know about this is that this is kind of an umbrella term. Okay, and what that means is that we use this term to cover a lot of different things that don't have a specific name for them. Okay, so let's talk about the anatomy of the knee. This is the right knee. Okay, so with the knee you have the femur. This is the long bone of your thigh right here, and this is called your tibia, and it's the shin bone. Okay, and then on top right here you have, this is called the patellar tendon, and it comes up and your quads, the four big muscles of your quads, attach right there. Inside of that tendon you've got the patella, okay, or the kneecap, and it sits right in here, and it kind of rests right in this groove of the femur. Okay, the reason that we have a kneecap is it actually acts as a fulcrum to help give more mechanical advantage to the muscles. Basically what that means is it allows those muscles to more easily straighten the knee. Okay, so let's talk about patellofemoral pain syndrome and what it is and how it happens. Okay, so patellofemoral pain syndrome typically happens when we start going into an increased level of activity from what we were doing before. So maybe you started playing a sport, or maybe you started training for a marathon, or maybe you've been sitting around all winter and then you get up and you start doing yard work, or you start going hiking, or any one of those many things. Okay, so let's talk about signs and symptoms of patellofemoral pain syndrome. Okay, typically this umbrella term, patellofemoral pain syndrome, refers to pain most specifically in the front part of the knee, kind of what we call the anterior portion of the knee. And this can present a little bit differently with a lot of different people, but you get this diagnosis when you don't have any real mechanism of injury. You haven't had a fall or anything like that. You may get some clicking and popping, but you don't really feel like there's like catching or your knee locks up or anything like that. Okay, it's mostly just kind of generalized pain that's hard to really pinpoint. It's just kind of in the front of the knee. The way that we treat this is that we actually need to do a personalized evaluation because it's going to be a little bit different from everybody. The hip, the knee, and the ankle all work together to keep us upright. If we have weakness, or if we have an area that's a problem in any one of those three joints, that can actually lead to pain at the knee. So we look at, when you come to physical therapy with this knee pain, we're going to be looking at your hip, we're going to be looking at your knee, and we're going to look at your foot and ankle as well. And what we do is we find the areas of weakness. Maybe your foot is dropping in a little bit too much as you run. And what that does is that actually puts pressure on the inside of the knee, which can cause some pain kind of on the front or the inside. Maybe your hips are a little bit weak. And so as you're running or as you're walking or as you're hiking, your hips will move a little bit, and that again will drop the knee into a position that's just not favorable for it. And so treatment of patellofemoral pain syndrome really includes a personalized evaluation and assessment of where your areas of weakness are. And then we address those, and whether maybe it's a mobility issue, we can give you some stretches to help you improve the mobility or the range of motion within the foot, the knee, or the hip. Maybe you have some weakness that's causing you to walk a little funny, and you've been doing this for a long time, and then it starts to create the pain. So it really just depends on what the weakness is for you that is creating this pain in the front of the knee. But what you need to know is that this is something is very, very treatable. This is something that we can help with, and we have a lot of success in treating this. So if you find yourself with pain in the front of the knee that you don't really know where it came from and it's keeping you out of doing the things that you want to do, you should come see us, and we can kind of figure out what's the best way to treat you specifically.